Hello guys, welcome back to yet another episode of Serious for a Minute, right? Yeah, leo tunaenda kuongelea kuhusu Achalasia. I know most of you have not heard of this, but it's a condition of the esophagus. It affects the nerves of the esophagus. Due to damaged nerves, it makes it hard for the muscles of the esophagus to squeeze food and liquid into the stomach. This leads to food collecting in the esophagus, sometimes fermenting and washing back up into the mouth. This sounds terrifying. So hii condition kuna vile ukiwa nayo food ukiswallow haiendi kwa tumbo, inabakia kwa esophagus, it does not enter the stomach. So with time the food ferments na kuna vile it washes back into the mouth. The food obviously will be bitter and it will have an awful taste. That sounds scary, man. So guys, have you guys heard of this disease? I saw a victim of this disease na kuna vile alikuwa anasema for her to eat lazima food ikuwe like liquid, like hata kaa ni ugali lazima ikuwe refined, graded or something like that. So you can imagine the horror she goes through. As I've said guys, the washing back of the food, sometimes it is called gastroesophageal reflux disease. Sometimes it's a condition of it on its own, and it could be confused with achalasia. But in this condition, the stomach acid repeatedly flows back into the tube connecting the mouth and the stomach, that is the esophagus. The acids those flow back in this disease, but see kama ile ingine achalasia where the food flows back, and it's often called the GAD for short. The backwash is known as acid reflux, and it can irritate the lining of the esophagus. Okay, back to achalasia. Achalasia is it's rare actually. I haven't had cases about this disease. This was my first case, so I decided to check it up, and I decided my people should get to know about this wale wananisikiza, and yeah, let's educate each other. So usiconfuse achalasia na GAD. GAD nimesema ni acid ina wash back into the esophagus, while achalasia the food washes back into the esophagus, so it's different guys. Let's understand the difference there. GAD ni acid ina wash back, while achalasia ni food ina wash back due to the food not being able to be squeezed into the stomach. Symptoms of this achalasia: 1. Difficulty in swallowing, also called dysphagia. Okay, swallowed food or saliva flowing back into the throat. Unameza kitu lakini inarudi, like umemeza mate na inarudi kwa mdomo. Heartburn, belching, chest pain that comes and goes, coughing at night, pneumonia from getting the food into the lungs. Due to the food not being able to go into the stomach, inaingia kwa mapafu. Weight loss, this is mainly due to unakula lakini no food is entering the stomach, so no nutrients are being absorbed, so that leads to weight loss. Vomiting, this is due to the food coming back into your mouth, thus you end up vomiting. Gauge yourself, we uko wapi. There are some symptoms zenye zina happen lakini si ati it means that uko na achalasia, but don't overlook them. Just seek medical advice na utajua uko wapi. So diagnosis of this achalasia: Most of the time this disease nasikia it's overlooked because symptoms zake ni similar to those of other digestive disorders. Just for this, for achalasia, a healthcare profession is likely to recommend the following. 1. Esophageal manometry. This test measures the muscle contractions in the esophagus during swallowing. Ina measure zile contractions. So it also measures how well the lower esophageal sphincter opens during a swallow. This test is the most helpful when deciding which type of swallowing condition you might have. So meaning achalasia si the only swallowing condition iko, kuna zingine, but tuta look into those other conditions baadaye. So as of now, let's concentrate on this. Another diagnosis recommended is x-rays of the upper digestive system. X-rays are taken after drinking a chalky liquid called barium. Barium coats the inside lining of the digestive tract and fills digestive organs. The coating allows a healthcare professional to see a silhouette of the esophagus, stomach, and upper intestine. In addition to drinking the liquid, swallowing a barium pill can help show a blockage in the esophagus. So tumeongelea kuhusu esophageal manometry, ini wana test zile contractions za muscles za esophagus, na kuna x-ray unakupewa the chalky liquid called barium, na pia kuna hiyo pill unapewa unameza. Okay, another one ni upper endoscopy. An upper endoscopy uses a tiny camera on the end of a flexible tube to visually examine the upper digestive system. Endoscopy can be used to find a partial blockage of the esophagus. Endoscopy also can be used to collect a sample of tissue called a biopsy to be tested for complications of reflux such as Barrett esophagus. My guys, sijui nitawaexplainia aje. That's why I'm saying, ukisikia this, just seek medical advice from the professionals. Mimi, I'm just airing out the basics. They'll see ati have knowledge on this. Pia mimi, I just tried to do a research, na this is what I came up with. Now if you want more understanding, please seek out these medical professionals and they will help. Okay, another diagnosis recommended by professionals is FLIP. FLIP in full, it's called functional luminal imaging probe technology. FLIP is a new technique that can help confirm achalasia diagnosis if other tests aren't enough. Ukiona hizi vitu zingine hazitoshi, just madaktari wakiona they are not giving accurate diagnosis, they use this FLIP. Okay, so another one is halamyotomy. A halamyotomy involves cutting the muscles at the lower end of the esophageal sphincter. This allows food to pass more easily into the stomach. Okay, this procedure, I think this is being used to help with the condition in but from this I hear ukifanya this halamyotomy, people end up developing GERD. As I've said earlier, GERD ni ile washing back of acid, stomach acids. Usiconfuse na achalasia, which is washing back of food into the mouth. But to avoid these problems with GERD, a surgeon might do a procedure known as fundoplication at the same time as halamyotomy. In fundoplication, the surgeon wraps the top of the stomach around the lower esophagus to create an anti-reflux valve, preventing acid from coming back into the esophagus. Fundoplication is usually done with a minimal invasive procedure, also called a laparoscopic procedure. Till we meet again, peace.